Hi all, you're watching DNA. This is Vikas Mavi, and India is witnessing a gradual uptick in coronavirus cases once again. And today with me is Dr. Pankaj Soni, Principal Director, Internal Medicine, Fortis Escorts, to talk about the sudden rise in the COVID-19 cases in India. Doctor, welcome to the show. So, first question first. What is causing this sudden uptick in cases?
Over the last 1 week, we have been seeing a lot of patients of COVID-19. There has been a certain
Right, sir.
sudden rise and cases being reported in India after the cases were being reported in Bangkok, in Singapore, in Hong Kong. So we have to remember that COVID-19 virus over a period of time has undergone several mutations, and each year when the COVID virus comes into circulation, it can be a new variant. So most of us have been vaccinated for COVID-19. Two shots were compulsory, and the third was the booster shot. So it is said that most of the patients who have taken the booster shots are immune to the COVID. But since the viruses are very notorious for variation, there can be episodes where even the patients who have been triple vaccinated can get a milder form of COVID. So they will not get the full blown COVID, but they will get a mild form of illness. And so definitely the vaccination will work, the illnesses will be less, the chances of severe COVID would be less for people who are vaccinated. Uh, as far as the prevention for getting COVID is concerned, we all know that it is the containment of the virus, it is your own precautions. So the first thing which we have to remember is what are the symptoms of COVID-19. So COVID-19 again, like we saw in the earlier 2020 and 2021.
सॉरी टू इंटरप्ट सर. थोड़ा सा आपको ना पीछे आना पड़ेगा. आप थोड़ा फ्रेम में आगे आ गए हैं बस. एज इन आप बात करते वक्त इंक्लाइन हो गए जैसे, बस उसके लिए. तो मैं सिम्टम्स पे आपसे सवाल पूछ देता हूँ, तो आप वहीं से स्टार्ट कर
ठीक,
दीजिए.
ठीक.
Okay. Uh, Sir, we also want to know about the symptoms of COVID. How can we identify that, okay, we need to go to a doctor?
So COVID-19 has symptoms which are very typical of an upper respiratory tract infection. So once you have fever, you have cough and cold, you have running nose, this can be symptom of early in symptoms of the COVID-19. So this is especially true when we are encountering patients with COVID-19. No, lot of patients are testing positive. So whenever we have a symptom of fever with upper respiratory tract infection, think of COVID. Get yourself tested for COVID. You can do a home test, or you can call the lab for testing and confirm that you are COVID positive. It is very important to confirm that you are COVID positive, because you can take precautions to self isolate yourself so that the disease
Right.
transmission doesn't.
Uh, but I, as a person, should I be worried right now, given the current situation of COVID in the country?
See, there is nothing to worry as far as COVID is concerned. I think the worst part of the COVID is behind us. So let's treat COVID-19, the present wave, as just like a upper respiratory viral infection. And the only thing is that we must take adequate, care. If we have fever, use paracetamol. If you have congestion, use decongestants. Take symptomatic care. Most of the patients are getting well in 3 to 4 days, and just be on the lookout for warning signs. If you have breathing difficulty, if you have chest tightness, if you have severe headache, you have clouding of consciousness, and like we did in COVID, earlier COVIDs, check your oxygen saturation. So these are the things which should be kept in mind. If you are following these practical guidelines, I think there is nothing to worry about.
So then, within COVID, there are also many variants, as you also told us. I want to focus upon this JN.1 variant, which has been making headlines. What do we know about it so far, and how lethal is it?
So I think presently what we all know is that it is again a very infective strain. Thousands of people have been reported which have been affected by this strain. As far as the lethality is concerned, we don't have sufficient data as to how many deaths it is producing, and it is directly attributable to COVID-19, because sometimes like we saw last few years, that some deaths were reported attributed to COVID-19, while they were because of certain other pre-existing illnesses. So we really do not have sufficient data at the moment to say how lethal this variant is. But yes, so that is why we our antenna should be on, and we should be under uh, take all the measures till we have definite answers to say whether this variant is as lethal as the 2021 or 2022.
Okay, but sir, as you said that people with multiple diseases should take care of themselves among this. So, I want to focus on this area. How does one take care of themselves in when he or she identifies that okay, I'm COVID positive? What are the precautions they need to take?
So when you identify yourself as COVID-19, I think the first precaution that one must take is to self-isolate. Self-isolate means isolate yourself for at least 3 to 4 days at your home, and preferably in a separate room, so that you can limit the spread of this virus, because the virus will spread through the droplet infections. So that is the first and the foremost. As far as looking after yourself is concerned, like I told you, the most important thing is hydrate yourself well, drink plenty of fluid. Viral illnesses are known to produce a lot of dehydration, a lot of electrolyte imbalances. So take care of hydration, take care of electrolyte imbalance, take care of your fever. I think the safest medicine to use is paracetamol. Sometimes we use paracetamol in low doses. So dose is about 1 milligram per kg body weight, can be taken every 4 to 6 hourly. I think that is the only medicine which can be safely taken as far as pain relief, as far as fever is concerned. If you have cough and cold, you can take decongestants or anti-allergic medications. They help in symptomatic relief, and one can continue to use multivitamin supplements if they are on. And there were reports that sometimes vitamin C or carotenoids, all these multivitamin supplements help during the time of acute illness, but these are anecdotal reports, not the mechanism is not sure, and the outcomes are also not sure. So the only three things are: isolate, hydrate yourself, eat balanced diet, take plenty of fruits, and manage fever with paracetamol.
Okay, great. Uh, but sir, coming back to JN.1, I would like to know, do our vaccines, which have been, the people have taken vaccination, are those vaccine able to, factor in JN.1, as in, can can our antibodies have our antibodies developed so much that they can protect us from this new virus?
See, all the viruses have multiple antigens in them. So when we were injected with the older vaccines, so we have produced an antibody response, most of us, especially after the triple vaccination. Most of us has sufficient antibodies. So that is one. Second is our human body also produces antibodies in response to an invading virus. So if we have a healthy immune system, some antibodies will be produced. Old antibodies will also act. So it's not 100% efficacious. We will not say that all the incoming viruses would be neutralized by the pre-existing antibodies. Some definitely would be neutralized. So what will happen is the extent of illness would definitely be less. So you will have less severe COVID once you have the antibodies which are there, maybe because of vaccination or your own antibodies because of good immune response.
Okay, I see. But doctor, are there any? Does the JN.1 variant differs from the regular COVID-19 variant? I mean, are there any different symptoms for it which need to be looked at, or
So
it's
presently,
just
most of the symptoms are coming only as upper respiratory tract infection. like we saw with the other earlier variants. So in between, there are few patients who do present with uh, gastrointestinal symptoms also. So either it can affect the respiratory system or the GI system. So most of the patients would have a respiratory tract illness.
Okay. So my last question to you would be: do you think the current cases in India are still under control?
Yes, as far as the disease in India is concerned, it is adequately under control. And I think with the robust vaccination program that we ran at that older COVID waves, is going to give us sufficient immunity to counter this variant. And I'm sure that this won't really spiral down into a very grave issue. It's just going to be like a severe form of cough and cold, and we must investigate, get ourselves diagnosed, and take adequate precautions.
Okay. Well, Doctor, thank you for the clarity. So, viewers, this was Dr. Pankaj Soni, Principal Director, Internal Medicine, Fortis Escorts. Uh, so, this was our take on the ongoing COVID-19 issue. What do you think about it? Tell us in the comments down below. And for more such content, keep watching DNA.